So welcome to another episode of Miami Med Gym podcast. I'm Jose Almeida. So today, DEXA scanners. What is a DEXA scanner? We have one here in the office. So I want to explain what these devices are. We use it for body composition tracking. Amazing device. It's a small amount of X-ray energy, and we get a lot of information. The device has been around for decades as for bone density evaluation, but since it's expanded into body composition, so we can get fat, muscle, and bone information. So with that, let's get to some slides here. And today we're on episode 17. What is a DEXA scan and why should you get one? All right, so the DEXA scan is considered the gold standard test for measuring body composition. And as we stated in the introduction, bone mineral content and density were the traditional uses, but it has since expanded into VAT, what we call visceral adipose tissue, and I'll get into that in a minute. Total fat mass and lean body mass. Lean body mass is not just muscle, it's also your organ weight. It's anything that's not fat. I believe even bones included in lean body mass. So this is what the device looks like. One lays down. It's a real gentle radiation. It's very safe. It's basically similar to the normal background radiation received over one day at sea level out in the sun. So not much radiation at all. We get one every 3 months when we follow patients. And basically, you just lay down for 5 to 10 minutes. Here's the information recorded by the tech, and this is the sheet that it spits out, and I'll explain that here. So, why is this important? Especially with weight loss, and we'll talk about semaglutides in a minute, which are all the craze. But what folks don't tend to realize, and we've talked about this before in the podcast, when you lose weight, you lose fat. Yes, that's great, but you also lose lean mass. So you're losing muscle, organ mass, and bone density if you're not careful. And the muscle loss can be as high as 30%. And I can vouch for this by experience. Again, I spent 20 years doing bodybuilding, of which 15 of those were prepping for shows. So 17 shows in 15 years. That means 17 diets. And I don't know if you're familiar with anyone who's ever dieted for a bodybuilding or physique show, but it's fairly stressful. So the main reason I bring this up, especially the last 8-10 weeks, as you're really trying to shed fat off the physique. And of course, we're trying to preserve muscle. And the challenge is you lose mass, you lose size a few weeks out, and it can be, problematic. You don't want to get on stage being super skinny and lean when you've worked so hard to build muscle, in the off season and over the years. Yes, it's a crazy sport, but you learn a lot of physiologic principles, especially dieting, especially how the macros work, the protein, carbohydrate, and fat, what they do in the body and how to manipulate them. So I've had experience with this. And yeah, muscle loss is a problem while you're losing weight. This is especially true in the elderly because sarcopenia is the loss of muscle that occurs naturally with age. And as we've stated before in podcasts, very important to preserve muscle mass for aging. And as we stated during caloric restriction, the ways to preserve muscle mass are by high protein intake and by resistance training. The skeletal muscle is a metabolic organ. It disposes of glucose, very important organ to regulate glucose, and we need muscle for longevity. As we get older, if you lose muscle mass, you're less, for example, you end up in the ICU, you're less able to fight off infection and inflammation. Hip fractures over the age of 65 are common. If you are frail without muscle mass, you won't get out of the ICU. So we use DEXA scanners here in the office when tracking patients that are trying to lose weight or trying to recomp or do body recomposition for physique purposes. And we'll talk about that a little more. We've all heard of the semaglutide craze, a Hollywood drug now. People using this medication to lose weight. It was intended for type 2 diabetes and the obese, but it's kind of broadened in pop culture for just basic weight loss. It's a glucagon-like peptide agonist, GLP-1 agonist, which means it mimics this hormone that's naturally produced in our guts, which stimulates insulin and inhibits glucagon. Therefore, it lowers blood sugar. But that doesn't seem to be the main mechanism of action for weight loss. GLP-1 or the semaglutide medications do all these things. Again, release insulin after eating to bring blood glucose down, which is necessary. High blood glucose levels more than 2 hours is the definition of diabetes. Decrease food cravings, delay gastric emptying. But the main thing it seems to do is by decreasing appetite. This is centrally in the brain, potentially by increasing leptin, which is a hormone, or satiety hormones. So when leptin is released, it tells the body we're full, we don't need more energy, and decreases appetite or increases satiety, the feeling of fullness. So it seems that these drugs act centrally to reduce appetite and food cravings as the main mechanism. The only reason I bring them up in relation to DEXA scanners is people are losing weight quickly, and if they're not followed, they're going to lose muscle mass, and it can become problematic for health. This is a little bit of a wonky slide, but for those listening who maybe want a little more information, orexigenic compounds. So orexigenic and anorexigenic. These are neurons that simulate eating, and they are neuropeptide hormones. So you may hear neuropeptide Y, and that's most representative, the most familiar is ghrelin, so the anti-satiety hormone. And orexigenic, again, these hormones like leptin, which we mentioned, suppress the appetite, let the body know we have adequate energy, we don't need to eat more. Okay, so that's just some little wonky information. So what does the DEXA scan tell us? So these are the images generated on the worksheet that are spit out by the computer after the scanner does its thing. We get a visual image of the precise location of bone, lean mass, and fat mass. That's over here. The yellow orangish is fat, bone is in blue, muscle is in red. And this would be the just the X-ray image. Plot percent body fat compared to age group. So using population data by NHANES, it's called, you can see where you lie in reference to the rest of the population for your age. So if you're down here, you're on the lower end of body fat. and then we can track this over time. So you get precise fat mass, lean mass, and percent body fat measurements in each area, in the arms, the torso, the abdomen, hips, legs. And that's all recorded here, the exact numbers. Calculation of percentages, fat mass, total mass, and lean mass percentages. Those percentages are recorded in this area. And then the estimated amount of visceral fat, which is the fat around the internal organs associated with metabolic disorders such as metabolic syndrome, cardiovascular disease, and type 2 diabetes. This is one of the main advantages of the DEXA scanner, vat volume, vat area down here. So these numbers, if they're high, they tell us risk for metabolic syndrome and cardiovascular disease, type 2 diabetes. So a lot of information. It's not just bone density as it was in the past. And then we can track. So this would be, tracking at different time points how the body fat percentage has decreased over time. Of course, that's what we want to see if that's the intended goal. If so, you can cheat yourself, you can cheat your nutrition coach, but when you get on the DEXA scanner, there's no lying. So you're either going in the right direction or you're not. If you're telling your coach that, yeah, you've been following the orders and these numbers trend upward, meaning an increase in body fat, well, again, we know what's truly going on here. So it's great for tracking body fat, lean mass. Ideally, if we're trying to recomp, again, we're trying to lose fat and gain muscle. That's the holy grail in the fitness world. You can do that with your DEXA scanner. And of course, you can see visually how things change. You should see less orange, less fat as you move through, if that's what you're trying to do. Visceral fat versus subcutaneous fat. So visceral fat is the one that's inside of you, around the organs, the one that you can't really see. And that's the most dangerous one. It's inflammatory. Subcutaneous fat underneath the skin that you can see is not really the dangerous fat. And then there's people like obese people that look terrible on the outside, but have no visceral fat on the inside. And that's called, healthy obese. And there's also, you've heard the term skinny fat. So people may have low subcutaneous fat, look okay on the outside, but be full of visceral fat inside, and they're really at risk for, heart attack, stroke, etc. So visceral fat we can see inside the body with the DEXA scanner. You'll see it called VAT, visceral adipose tissue. That's visceral fat, viscera or organs. So the fat around the organs, it can be around the stomach, liver, intestines. So visceral fat, as we stated, can lead to many serious health problems, including metabolic syndrome, we've mentioned, cardiovascular disease, impaired glucose lipid metabolism, i.e. diabetes, insulin resistance is a big one. Increased risk of cancer, high blood pressure, hypertriglyceridemia. So visceral fat is bad. Now, this is a good little diagram from Robert Lustig. So eating excess fatty food, processed food, will increase your visceral fat. So will inactivity, a sedentary lifestyle. We said in the last podcast, really takes minutes off your life if you're sedentary. So how do you decrease your visceral fat? Of course, healthy diet and exercise. We keep beating that over the head in this podcast. So down here, when you take in excess energy or food, specifically refined, processed food, This spikes your insulin. So food or high, as you digest the food and absorb it, the glucose or sugar in the blood rises. This stimulates the release of insulin from the pancreas. The pancreas is sending a signal out that, hey, we need to get the blood glucose down. We need to store the energy somewhere. And the main organs are fat cells, the liver, and the muscle. So high insulin causes energy storage. That's really the main role. Yes, it drops blood glucose, but really energy storage. So if your fat cells, so glucose is taken up by the fat cells through GLUT4, a carrier. So glucose is taken up by the fat cells start to grow. At some point, the fat cells will outgrow their blood supply and become inflamed, and you'll get fat spilling out of the fat cells into the circulation, which stimulates more insulin release. So at some point, insulin, the tissues stop listening to it. So you get hyperinsulinemia. Insulin levels stay high, especially if you're eating all day long. Your insulin doesn't have a chance to come down. It's only when insulin levels come down will you burn fat. Okay, that's a very important principle. So if your insulin levels remain high because you're eating all the time, especially carbohydrates and processed food, which is what we call the standard American diet, why this is an epidemic. Insulin is high, and you're constantly storing fat in the liver and in the muscle. So fatty liver is a big problem. This causes liver dysfunction. Fatty muscle, which is our main glucose disposal tissue, up to 80% of glucose is disposed in muscle. If your insulin levels are high, it turns into fat in the muscle. This all ends up causing insulin resistance, inflammation, metabolic syndrome. So it's really the sugar getting converted to fat that's the problem. That's the issue. That's why we get insulin resistance and metabolic syndrome. Okay, very important principle. Best way to reduce visceral fat is a healthy lifestyle. Eat a balanced diet. And this is what we're talking about, is basically eliminating processed food or hyperpalatable foods. Whole food is what you want. If you're eating a lot of protein and fruits and vegetables, just by nature, this is very satiating. You don't overeat. You can get full, but the body will just say, listen, I'm full. I don't want anything else. Whereas if you're eating Oreo cookies, you'll just keep pounding them. It's what we call hyperpalatable food. So you want to be eating whole foods. If you just do that, you're probably going to be healthy. You've heard this your entire life. You got to remain active, exercising regularly, lifting some weights, yoga, getting enough sleep, avoiding sugary foods and drinks. As we said, alcohol is another bad one. It's sugar. It gets metabolized the same way as sugar. Alcohol, as we know, causes fatty liver. So do sugary foods, fatty liver. Plenty of water, avoid processed foods. The RDA, recommended daily allowance, states that about 0.8 grams per kilogram per day is all you need. However, all the data coming out is that we probably need double, or 1.6 grams per kilo, or 1 gram per pound of body weight. So me, a 200 pounder, need about 200 grams of protein a day. That will maintain protein synthesis. You want to separate those meals out. At least a 30-gram meal will have about 2.5 to 3 grams of leucine. Leucine is the amino acid that turns on mTOR. mTOR stimulates protein synthesis. You want to space the meals out so that mTOR is not constantly activated all day long. We want to allow for autophagy. So this is the getting rid of bad cells, basically. So the longevity space talks a lot about autophagy and AMP kinase, which is the opposite of mTOR stimulation. So the point here is that weight training and high protein diets build muscle. Muscle is a very important tissue for glucose disposal and longevity and overall health. The best way to do this is by eating adequate amounts of protein. I'm not going to get into the animal versus plant protein argument, but eating protein and lifting weights is the healthiest thing for you. Resistance training is the real only way to develop strength and stimulate muscle hypertrophy. And these are, of course, key components of conditioning for sports, if you're interested in that. Muscle hypertrophy occurs when muscle protein synthesis exceeds muscle protein breakdown. Okay, so we want a net positive protein balance. And this can be achieved by resistance training and protein ingestion. I just keep beating this horse every podcast so it really starts sinking in for people, because this is really what you need to be doing to be healthy. So we mentioned body recomposition. If you're getting ready for, again, bodybuilding competitions, as I did for many years, we want to lose fat while gaining muscle. And again, the DEXA scanner allows us to follow someone. So if you're losing too much muscle, that means you need more protein and perhaps more weight training during the dieting phase. If you're not losing enough fat, you can track that with the DEXA scanner. So you may need to tighten up the diet. It's a real valuable tool. And this is just an example of one of our patients here at the office, the Brickell office, where we have the DEXA scanner. A patient weighing 340 pounds. We got him in the gym and on a diet. And as we track his DEXA, we see that he was able to, his lean mass was 85 when we started 3 months prior. He actually gained a pound or a kilogram of lean mass. His body fat percentage dropped from 37 to 31, and his visceral fat dropped from 318, which is a dangerous level, down to 250, which is still high, but again, we're tracking in the right direction. And that's very encouraging to the patient when he saw these numbers, that he's on the right direction. So that's a positive feedback when they see this, and people are more apt to stay on the course and not fall off the wagon per se. Very valuable tool, the DEXA scanner. So that's all I got for you today, episode 17. Please like and subscribe if you like to talk, and I'll get back with you next time. Thank you.